Hello and welcome to the One Medicine podcast from today's practitioner. In each episode, we share the expertise of a respected thought leader. Some you'll know and others you'll probably meet for the first time. We cover topics important to you, always with a focus on improving the health outcomes of the patients you treat while expanding your understanding of the many healing modalities being used today. Welcome to the One Medicine podcast. I'm Rob Lutz, your host, and with me today is Dr. Lexi Loch. Dr. Lexi is a licensed naturopath, and we'll be talking about inflammation, acute and chronic inflammation, its impact on your patient's health, and pros and cons of different treatment options, and a number of other topics that we'll cover over the next 45 minutes or so. Dr. Loch, Dr. Lexi, thank you so much for joining me today. I really appreciate it. Before we get started, can you just share with me a little bit about how you came to become a naturopath, and maybe a little bit about inflammation, how you've addressed it in your own practice?
Absolutely. Well, thank you so much for having me, Rob, and the One Medicine podcast. It's great to be here. I mean, inflammation is quite a buzzword these days, so I think it'll be a really fun discussion. So a little bit about my background. I come from the world actually of veterinary medicine. So I got my start, my first kind of medical career, I guess, was on the animal side of things. I'm still a crazy, passionate animal person. I have 3 dogs, fingers crossed, they stay quiet. But so I worked in veterinary medicine as a certified veterinary technician for several years. Love what I did, but got burnt out pretty quickly. And I was looking for a big change. And at this point in my life, I was already shopping at the local health food store when I was living in Green Bay, Wisconsin. And I heard that they were looking for a sales associate. And I was like, look, I'm already spending a lot of time and dollars here. So if I could get a discount, that would be great.
Yeah.
So I jumped over to the health food store and just absolutely fell in love with everything that was there and just, reading every little label, trying to read between the lines. So that was kind of where I like to say I fell down the rabbit hole of natural medicine.
Yeah.
And part of my own journey too also involved, I've been a lifelong athlete. I've played volleyball since, I was probably like 10 years old. Love volleyball. Played throughout my undergrad and college. Ended up with a lot of chronic low back pain. And I was trying everything. They were even prescribing me Vicodin at one point. And
Terrible.
I went and met with a specialist who said, we could do a spinal fusion. I mean, I was 20 years old.
Wow.
And I was like, I don't know if surgery is the right option.
Absolutely not. Yeah.
So I started exploring a lot of other techniques. That was kind of when I got my first introduction to like acupuncture and body work. So those 2 paths in my life, dealing with chronic pain and then also kind of jumping into the health food store, they kind of merged and just like created this love of, natural and holistic modalities for me.
Yeah. And I'm sure they worked for you, right? So that's right. You didn't have to have surgery, which I've heard people say, like, you don't get back surgery until you literally can't walk. I mean, because it's not a permanent thing and there's all sorts of risks involved and your back's never going to be the same. Yeah.
Exactly. I actually had a teammate who had already had a back surgery on my college team. And, she had some relief, but not all. And granted, she was only one person, but still, I was just like, I think there's got to be more that I can do.
Yeah.
So when I was working at the health food store, I just would go home and research topics that interested me or research questions that people asked that I didn't have the answer to. And then eventually I started working for Europharma, which is the parent company to the Terry Naturally brand dietary supplements and Euromedica. So I work in the education and science department, and now I have been with them for over 10 years.
Wow. Yeah. Those guys are great. And full disclosure, they do some work with today's practitioner but love their products and feel confident that the ingredients they use and the dosages that are in there, that's why they work. One thing that you hear a lot about with a naturopath, and maybe this relates to kind of your journey a little bit, is root cause medicine. That's why surgery wasn't really probably the answer, because it's not going to fix what caused it in most cases, right?
100%. I was actually doing some research for a different presentation a little while ago, and I was looking just kind of at some of the statistics out there on like surgery, low back pain, what are the outcomes, what are the risks? And I found out that almost 1 million people every year undergo back surgery.
Wow.
Which tells us, right, like people are in an epidemic of pain and chronic inflammation. And there are some positive outcomes for certain types of procedures, whether it's
Sure.
like alleviating nerve type compression pains, or cancer, infections, things like that. But
Yeah.
overall, I think we have a lot of other things that we can try kind of before moving to like the top of what I consider like the pyramid,
Yeah. Well, we don't have to talk too much about kind of the physical therapy type of stuff, but same. I'm an athlete, longtime athlete, and I've injured myself lots of times and had low back problem. And, really what I found was muscle imbalances, sitting a lot, caused that. And I read a book called Becoming a Supple Leopard. I don't know if you've seen that, but it's written by Kelly Starrett. He's I guess a PhD physical therapist, genius guy, right? And very aggressive in how he works with physical therapy, but lots of relief for those types of things, and it's just kind of amazing if you can do some hands-on work. And of course, natural pain relievers or anti-inflammatories and things like that are key as well. But
well, thank you for the book recommendation. I am an avid reader, so I'm always looking for new
yeah,
new things to peruse. But I think it brings up a really good point, right? It's like, what are the modalities that we can do to hopefully resolve some of this underlying inflammation?
right.
And yeah, I think that kind of clues us right into our topic here, because I don't know about you, but I feel like when the word inflammation is thrown around, it always gets a negative connotation. And
Right.
I do a lot of education with my patients about inflammation isn't an and or. It's not, it serves a purpose in the body. It is a
Yeah.
yes and. Inflammation can be life-threatening, inflammation can be life-saving. I mean, we as a species wouldn't exist without inflammation. I actually saw a statistic from a research article that they found signs of inflammation on dinosaur bones. So it's like inflammation is an ancient
Yeah.
process. I mean, millions and millions and millions of years old, and it wouldn't have been conserved across, multiple
True.
species if it didn't serve a purpose, right? And I think the big issue is when acute inflammation. So, as a volleyball player, I'll just throw out, I've fallen down and rolled my ankles more times than
Hmm.
I
Yeah.
would care to share. But, acute inflammation, of course, we're talking about redness, swelling, heat, pain. I mean, those kind of cardinal signs of inflammation, those were documented by the ancient Egyptians on papyrus. So, I mean,
Right.
these, again, are very well known to us as humans. But I think when we're unable to resolve that acute inflammation and it moves more into the chronic
Hmm.
inflammation, that's where people really get in trouble. One of the big things too about chronic inflammation is it doesn't always have symptoms. It's not necessarily like you can feel chronic inflammation in your elbow, right? Like it's kind of insidious. There may be some, loss of function. There may be some, I don't know, generalized fatigue or feelings of unwell. But I think that's one of the tricky things of chronic inflammation is it can be kind of difficult to pinpoint for
Hmm.
people.
Hmm. So, you mentioned that inflammation isn't all bad. Give me an example or how inflammation is actually a good thing. What would that scenario be?
So let's say, we have some type of viral infection or some type of pathogen that's in trying to, set up shop inside of our body. I mean,
Mhm.
we are going to use our immune system, which uses various forms of inflammation or pro-inflammatory cytokines to help clear that pathogen. So it
Mhm.
actually helps to protect us against those pathogens. It kind of helps to isolate whatever that area is from the rest of the body. So we're sending, we're having a
Mhm.
lot of increases in blood flow. We're sending immune cells to that area. And overall, the inflammatory process, when it is done properly or efficiently, will initiate repair processes
Mhm.
after we kind of clear that initial infection or whatever it is. So, I mean, inflammation is our body's way of kind of helping us heal, recover, repair, defend,
Mhm.
just exist, basically.
Yeah, right. And I guess that's why it's been, continued along the evolutionary process. It's something is stuck with us because it has a good feature to it.
Exactly. And I think one of the big things I try to educate patients on too is some of the dangers of the nonsteroidal anti-inflammatory drugs. Because
Mhm.
if we look at their name, they are anti-inflammation, which sounds great, right? You're like, okay, I have inflammation. I should take an anti-inflammatory and all of my problems will be solved. Well,
Mhm.
I think we know that the nonsteroidal anti-inflammatory drugs carry a host of side effects, whether
Mhm.
that's, GI issues, potentially ulcers, changes to liver and kidney function, heart issues.
No free lunch.
Yeah. Yeah. And I mean, these are like some of the most frequently used drugs out there. And they're
Absolutely.
available. Yeah, and they're available over the counter. I am of a philosophy that I honestly think that they should be prescription
Mm,
because people, I've done it. I've popped a handful of ibuprofen, before I got introduced to this world.
yeah,
It's
same.
like, yeah, I have
Yeah.
aches and pains. This thing takes away aches and pains, so I'm going to use double what it says on the label because I'm smart, right?
Well, I remember back in the early 90s, and I was friends with some, kind of world-class athletes, triathletes. They were taking 20 or 30 of these things in a day, right? And I had a broken foot from skiing, and I bought a ski pass, and I was in my 20s, so I was going to continue to ski,
Of
of
course.
course.
Yeah.
So I took a lot of them, and thank goodness I didn't destroy myself because it was a lot of ibuprofen I was taking. And I don't really take it now, but yeah, that's
Yeah.
could have
I
been some
mean, they're
problems.
they're so widely accessible, but they can increase the relative risk of GI bleeding by like threefold.
Hmm?
Some studies even up to tenfold. And I think somewhere around like 15 to 20,000 people die every year from the use of these things.
Right.
Now, that alone is a very scary statistic, but on the other side, the anti-inflammatory drugs work by shutting down the production of compounds like prostaglandins,
Mhm.
which we make in like an acute inflammatory situation. But when they shut down the production of those pro-inflammatory compounds, it also shuts off the signal to the body to then make anti-inflammatory compounds or
Mhm.
resolve the inflammation. So yes, you're getting kind of a short-term payoff by decreasing the production of things like prostaglandins, prostacyclins, thromboxanes, etc. But those are also cues to the body that, hey, we're producing these, but then we also need to shift over into like the resolution
Mhm.
side of things. So there's a big difference actually between like anti-inflammatory and pro-resolution. And so the NSAIDs are anti-inflammatory, but they don't help the body resolve what
Mhm.
actually caused the inflammation in the first place.
So that you get some symptom relief, but you're not really healing the body as well as you would otherwise. Is that
Exactly,
okay?
exactly. It's like, yes, you're kind of putting a Band-Aid over the problem, but again, we're not really addressing, like you were talking about, that root cause.
Mhm.
We're using these to get some temporary relief, which I understand. Like
Of course.
it's a bummer to have an
Totally.
acute inflammatory issue, but again, like we're kind of overriding the body's natural processes, which would shift us from inflammation to then coming into resolution.
Okay. Thanks for that explanation. That does make a lot of sense. Yeah, and I think these over-the-counter medications, for inflammation and pain, Tylenol, ibuprofen, those types of things, they do have a long list of issues that go along with them, right? So let's say you have a patient who comes in, and I think we've said, or we spoke maybe before the podcast started, is there's really no one test you can take to evaluate your inflammation level. So
It,
as a
it is
practitioner, what do you do?
There are some labs that can be done, but unfortunately, there's not really like a one size fits all answer as far as like if you were to run like CRP or even high sensitivity CRP or ESR, erythrocyte sedimentation rate. So a lot of times I'm just kind of going off of what the person tells me.
Mm-hmm.
And, as naturopathic practitioners, we're also digging into some of the nutrition and lifestyle. And I'm trying to kind of build a picture in my head of what might their kind of chronic inflammation picture look like? Like,
Mm-hmm.
what is their chronic inflammation burden? Because, I mean, at least 1 in 3 people in the US have some type of chronic inflammatory disease. So there's a good chance that whoever we're working with is carrying a higher level of chronic inflammation overall. I mean, we all are, right? Like, whether it's the environmental chemicals we cannot see, or sometimes those that we can see, or it's the pesticides in the foods. It's oh my gosh, I just read an article about the microplastics in tea bags. I'm like, I love tea. And
Right.
I'm like, oh my gosh. I'm like, where does it end,
Yeah.
So, I just am kind of operating under the premise for most people that yes, we are dealing with some type of chronic inflammation picture. And then we kind of shift over to what are the things that that person can do from like a stress management standpoint, from a nutrition standpoint, hydration, sleep.
Mm-hmm.
I mean, all of these kind of foundational elements.
Foundational. Yeah.
And when we are working with those, those changes sometimes take a little bit longer. So then I'm also using natural medicines like curcumin, boswellia, omega-3s to also kind of help palliate and get them into more of that like pro-resolution phase.
Hmm. And how do those particular, botanicals or the omega-3s, how does that even work? What is the process there in the body that's helping with the
So
inflammation?
what I love, I am like a crazy plant person. I love a lot of plant medicines. I also love, all of the other nutrients as well, but I self-identify as a crazy plant person. So I'm going to start out with curcumin and boswellia. I mean, most folks out there have heard of turmeric, right?
Hmm.
Turmeric is a fantastic spice. I have stained a lot of surfaces in my kitchen yellow because it is a very vibrant pigment. And turmeric contains a compound called curcumin. Curcumin is probably one of the most well-researched natural compounds out there. Last time I checked, it had over 25,000 published research studies. And we know that research is expensive. So they keep doing research on curcumin because there continues to be wonderful, wonderful results. So curcumin has the ability to kind of downregulate some of our major pro-inflammatory cytokines.
Hmm.
So things like IL-1, IL-6, TNF or tumor necrosis factor alpha. I mean, curcumin kind of has these multiple mechanisms by which it can kind of reduce the overall inflammation burden in the body. But on the flip side, it also helps with pro-resolution.
Hmm.
It increases anti-inflammatory mediators. It increases our overall antioxidant status. So again, it's kind of working on both sides of the equation. And that's where I kind of think of these more as like inflammation mediators versus like an actual anti-inflammatory.
Right.
But for general purposes, I will just refer to curcumin as an anti-inflammatory, even though it's working, on more levels than that. So there's
So
another
it's not going to have the same side effects as an ibuprofen then, right? Because it's more
exactly.
balanced in what it's doing.
What I love about curcumin is it actually can protect against some of the things that like the NSAIDs can harm. So it promotes liver health, it
Hmm.
promotes GI health. It's been shown to actually protect against nonsteroidal anti-inflammatory drug-induced ulcers when it was given simultaneously. I believe this was an animal model. But yeah, so it kind of helps to protect against some of those negative effects that can
Hmm.
come from like the NSAIDs.
Are there any medications that you're aware of that could be some kind of an interaction between that substance and a medication a patient might be taking?
So, one of the biggest classes of medications that I'm always super, super, super cautious with are going to be like your older types of blood thinners. So,
Hmm.
like your Coumadin, warfarin. So, what I've done in the past with people who are interested or who I think would be a good candidate for taking curcumin is I have them talk to whoever their prescriber is for like the Coumadin, warfarin and ask if they can do a 1 week trial.
Hmm.
So, can I take this curcumin for a week and then see or evaluate if there are any changes to like the INR, like the bleeding times.
Hmm.
And I've had a lot of patients do this and they've been able to stay on the curcumin.
Hmm.
One of the things that sometimes people get a little bit confused is they think that curcumin is a blood thinner,
Hmm.
which what it does is it more acts on the platelets themselves. So we know that the platelets help create things like blood clots if we have a cut on our arm, something
Hmm.
like that. But when our platelets become inappropriately activated, that's when they can start to clump together in like the bloodstream and lead to some type of blood clot.
Hmm.
So curcumin kind of makes sure that the platelets stay kind of like a smooth appearance. They don't get overly attached to each other. They don't become overly sticky, if you will. So that's kind of on the side that curcumin acts on.
Okay. It's just my own curiosity, but what about you have a patient who might have high cholesterol or, some other markers that indicate some issues with their cardiovascular health. Is this a good supplement for them to be thinking about? What is it a go-to for you in some ways?
I hesitate to think of almost any patient that couldn't benefit from, a good curcumin because curcumin has research for cardiovascular issues, whether it's atherosclerosis, hypertension. It can really help, again, kind of lower that overall inflammation burden in the body, which is
Hmm.
going to kind of take the pressure off some of the end organs or, systems that are impacted by that higher level of inflammation. So
Hmm.
I have almost all of my patients on
Yeah.
curcumin,
Yeah.
and I honestly think that just about almost everyone out there with just the assault that we're under for all
Yeah.
of these things that are causing inflammation in the body. I think we need to, have a lot of tools in our toolkit, and
Hmm.
curcumin is one of my favorite tools.
Yeah, just it sounds like a go-to for you for just about everybody. Anything else on curcumin that you want to mention or?
I will just point out there are like a couple studies that I sometimes will talk about with patients. First and foremost, there are a ton of different curcumin preparations out there.
Hmm.
There are some that are using synthetic curcumin, which you're like, oh my gosh, I didn't even think that you could make synthetic curcumin. Unfortunately, they're using like petroleum-based derivatives to make curcumin. So it's always, always, always going to be like a buyer beware type of situation, which is where I think us as integrative practitioners can help kind of direct customers and patients to the right
Hmm.
product.
Hmm.
So I personally have the most experience using curcumin with turmeric essential oil.
Hmm.
So turmeric essential oil itself helps with anti-inflammatory, antioxidant, pain-relieving properties, and helps to boost the absorption of curcumin, because on its own, curcumin can be quite difficult to absorb.
That's what I
Um,
hear. Yeah.
but when it's combined with turmeric essential oil, it's up to 700% better absorbed than just like your standard curcumin.
Hmm.
And this type of curcumin has 90 published research studies, and almost half of those are human clinical trials. So I think 41 or 42 of them have been done in humans. So
Yeah.
I always like to follow the research. You can't always research every exact mechanism for every natural substance out there, but I think the breadth of research on curcumin at this point gives us a lot of good clues as to what it can be used for.
We have a few great articles on this exact topic and the essential oil on the site, and I'll include those in the show notes if anyone wants to go a little bit deeper on that. But I think it's really fascinating because I had never heard of that before, the essential oil.
Yeah,
It's for me, it's fairly new.
I actually
Obviously.
saw that it came in as one of the top 10 articles for Natural
Yeah.
Practitioner in
Yeah.
2024.
Yeah.
And I was like, oh, yes, see,
Yeah.
there's still so much interest. And I think, for a lot of people, it's like curcumin reduces inflammation. It can reduce pain. It can improve liver function. I mean, there
Mhm.
are just so many uses. Like there was one study looking at curcumin compared to acetaminophen and looking at its impacts on C-reactive protein and TNF alpha. And probably not surprisingly, curcumin outperformed the acetaminophen. This was like a 6-week study. There's also studies on curcumin for folks with osteoarthritis compared to ibuprofen, where it
Mhm.
outperformed the ibuprofen. So again, it's like we have tools. I think we just need to, kind of help educate folks how they can be used and kind of best practices with them.
Yeah. So what kind of a dosage would you recommend? Of course, any practitioner or anyone who's listening to this is not medical advice, just to be clear on that. But I'm just curious for my own information, what are some dosage ranges that you look at for an average patient or any specifics as well?
Absolutely. So generally, I'm recommending 750 milligrams of the curcumin with turmeric essential oil that yields 500 milligrams of the curcuminoids total.
Hmm.
And one of my primary reasons for that is the majority of those clinical studies done on the curcumin used 2 per day of that 750
Got
milligram.
it. Okay.
And they had super impressive results. So I was like, you know what? I like to follow the research. There were a few studies that used higher dosages. One study used, I believe, 6 per day, and the most recent clinical trial actually used 16 per day. So
Wow.
8 grams of curcuminoids, but it was an interesting study on folks with multiple myeloma
Hmm.
who were ineligible for a bone marrow transplant. And so every one of the participants took like chemo, some type of chemo and prednisone, and then
Hmm.
half of them were also given the curcumin with turmeric essential oil. And the folks that received kind of that adjunctive curcumin, I think it was something like 75% of them went into remission,
Wow.
whereas only 21% of the people who were on the 2 drugs only went into remission. So, I
Hmm.
mean, it was a much higher
Yeah.
dosage than what I've personally experienced or have experience with. But, if I had multiple myeloma and I couldn't get a bone marrow transplant, I would also probably be trying as many things as I
Yeah.
could. So it's pretty incredible, what it can really
Yeah.
do.
Yeah. That is amazing. It's just amazing also to think about different topic for another time, but these plant medicines, how they were discovered initially, the trial and error of figuring things out, and then just kind of the knowledge base that was passed down. And now it's being verified with, real clinical studies. That's pretty amazing.
Yeah, I love that kind of like the ethnobotanical
Yeah.
uses. And it's like, yeah, I'm growing some turmeric, it's overwintering in my she shed in the backyard. Fingers crossed it survives the winter.
Yeah.
But, would I have known prehistoric times to just like chew on this tuber and see what happens, or this rhizome, I guess. But yeah, it is quite fascinating.
Yeah. I mean, I wonder, I'm sure they were much more connected to the land and the environment back then, and they're probably more aware of things than we are today. But it is interesting to think how that all came about. But that would be another topic. So what other botanicals or supplements do you think about and recommend to patients for inflammation?
So I kind of think of curcumin as touching just about every single inflammatory pathway in the body. And again, it's more of a modulator versus like a pushing all of those pathways down. But what I love to combine curcumin with is another botanical called Boswellia. So Boswellia is a tree medicine. There's about 20 distinct Boswellia species. They grow in places of the world like India and Northern Africa. And they're really interesting because the way that you derive medicine from them is by scraping the bark. When you scrape the Boswellia bark, it kind of exudes these like resins, or what they call Boswellia tears. Now, I think about this, I live in the Pacific Northwest. So it's like if you see a big evergreen tree lose a branch, it's like that sap that it produces, right? Like that's kind of analogous to what the Boswellia resin is. Now, the reason that I like Boswellia so much is because it helps to reduce a specific type of inflammatory pathway in the body called 5-LOX. So curcumin acts more on like the cyclooxygenase or the COX side of things, whereas Boswellia acts on this 5-LOX pathway. When we have high levels of activity in this 5-LOX pathway, we're producing a lot more leukotrienes. And leukotrienes are inflammatory compounds that play a big role in like lung issues, gastrointestinal issues, joint issues, even certain types of cancer. So if we can reduce that 5-LOX inflammation, that also translates to generally like a big reduction in symptoms and more comfort for people. And it's tricky because that 5-LOX pathway really isn't touched by a lot of substances, whether they're natural or pharmaceutical. One of the biggest pharmaceutical medications used to address 5-LOX inflammation is steroids. So there's a lot of 5-LOX activity in asthma. So that's why the doctor doesn't say, pop an ibuprofen and call me tomorrow. They're like, use your asthma inhaler, which is going to act on that 5-LOX pathway. So Boswellia combines really well with curcumin because when you have the combination of them, again, you're covering pretty much every single inflammatory pathway in the body.
Amazing explanation. I love it. Any other, I think you mentioned omega-3s as another?
Yes. So omega-3s are probably, most people think of them maybe for like heart disease or things like that. Omega-3s are, omega-3 fatty acids. The two that we are probably most familiar with are EPA or eicosapentaenoic acid, DHA, docosapentaenoic acid. But basically the reason they're so important is omega-3s are essential, meaning that our body cannot produce them. So we have to obtain them from either diet or supplemental sources. What's really cool about omega-3s is I think just like 20-ish years ago, there was a doctor, Dr. Charles Sirhan. Him and his team were doing research on omega-3s, and they actually found that omega-3s are precursors to these really important compounds in the body that they named specialized pro-resolving mediators. It's a mouthful, but they're called SPMs. But if we kind of look at the name, specialized pro-resolving, again, so they are pro-resolution of inflammation. So if we are deficient in omega-3s, it's kind of easy to theorize that we would be deficient in our body's ability to go in and resolve inflammation. So some of these specialized pro-resolving mediators have names like resolvins, protectins, merisins. I don't really know why merisins got that name, but the other, resolvins and protectins, it's intuitive to be like, oh, these resolve and protect. So we also know that a lot of folks out there are having much higher intakes of omega-6 fatty acids, which aren't all bad, but it's all about that ratio, right? It's all about the balance between omega-3s and omega-6s. And we just are so skewed at this point, with the omega-6 fatty acids that it can actually interfere with our body's ability to use omega-3s and create some of these, pro-resolution compounds.
That makes sense. you've got a patient that comes in, are you going to prescribe all three of these typically?
Generally, when someone comes in and they have inflammation and pain,
Hmm.
I'm usually going for a combination of curcumin, boswellia, black sesame seed oil, or curcumin, boswellia, DLPA nattokinase. That's
Hmm.
kind of like my first line for pain specifically. But generally, I'm putting most folks on, curcumin with turmeric essential oil, at least as a standalone initially.
Hmm.
If they have lung issues, GI issues, various forms of arthritis, etc., then I might throw in the Boswellia as well.
Okay.
Uh, Pretty much everyone out there could benefit from higher levels of omega-3s. So I'm usually doing some education around why omega-3s are important, what they
Hmm.
can do in the body, especially for folks who aren't eating, a lot of seafood, or they're vegan, they're vegetarian, they have specific dietary, restrictions, whatever that looks like.
Hmm.
So I think the omega-3s are a crucial point as well for most people.
And what kind of a dosage are you looking for daily?
So when it comes to omega-3s, a lot of people equate omega-3s with fish oil, and they are not the same thing. So fish oil is kind of like a carrier for the omega-3s,
Hmm.
but it's not necessarily like the most optimal carrier. So I'm usually recommending omega-3s attached to phospholipids, which is
Hmm.
how you would find them like in fish,
Hmm.
because the phospholipids help to protect those sensitive omega-3s.
Hmm.
Omega-3s don't really like a lot of light or oxygen or extreme temperatures, so they are quite delicate. So
Hmm.
the phospholipids kind of help to shield those omega-3s so they don't go rancid.
Okay.
Um, so I'm recommending omega-3s with phospholipids and peptides. So sometimes it looks like it's a lower dosage, somewhere around like 270 to 290 milligrams.
Hmm.
But when you use omega-3s with phospholipids, they're absorbed a lot easier because
Yeah.
they're more easily recognized by the body. So you don't need to take like tablespoons of fish oil to get equal level of omega-3s on board.
Okay. That makes sense. Yeah. It's really about how much gets into your system rather than how much you put in your mouth, I guess. Yeah.
Exactly. And because it's not in an oil based, people tend to tolerate it a lot better, and they don't always get some of those fishy like burps or
Right.
regurgitation,
Yeah.
which from a treatment plan adherence standpoint, that's going to impact. Like
Absolutely.
if
Yeah.
I'm burping up, fishy taste stuff, I'm like, yeah, I'm done with this
Yeah.
supplement.
That's
So
it's very unpleasant when you've tried it and you're like, wow, that's it's not
yeah.
doesn't taste so good. Yeah.
Exactly. So
Um,
always trying to find ways to help people stick with treatment plan recommendations
yeah.
and have it not be a source of stress in their
And
life.
that's always got to be a challenge for a practitioner is adherence to your plan. Are they going to stick with what you're telling them to do? Probably easier with a few supplements. We haven't yet quite talked about the, lifestyle and dietary stuff, but I'd love to chat on that a little bit because that is foundational in a lot of ways and probably makes a big difference in a lot of other areas in their life as well. So how
Oh,
do you talk to a patient about some of those changes that might be necessary if you are trying to reduce inflammation?
so I think one of the biggest things we can do for reducing inflammation is getting our bodies moving. I mean,
Hmm.
we are designed to be moving, and whether that, was foraging or hunting or,
Hmm.
exploring, like our bodies are designed to move. And unfortunately, a lot of us are just sitting so much more than what
Terrible.
historically we would be able to do. So I'm coaching folks on how to get even, an extra 5 to 10 minutes of movement per day. I'm not
Hmm.
saying I need you to get 150 minutes of activity, per week, which is the goal to work up towards.
Yeah.
But when folks have, high levels of inflammation and they're feeling fatigued and they're feeling unwell, they're not going to be able to go straight into,
Right.
2.5 hours of activity every week. So I'm trying to find ways that we can incorporate more movement throughout their day. And I try to sometimes stay away from the word exercise just because I feel like exercise gets a negative connotation. So
For
it's like,
sure.
park a little further away, or take the stairs when you can, do some chair yoga, do some gentle stretching, tai chi and qigong, like some of these gentle moving breathing activities I think can be really profound for a lot of people. And again, we're moving our lymph, so we're kind of using the body's like waste disposal system more efficiently, which is
Hmm.
going to help kick some of these inflammatory compounds out of the body or remove them in other ways. So I think that movement is probably one of my biggest treatment recommendations.
Hmm. You touched a little bit on how to get your patient to adopt some of these new habits. Those weren't the exact words you used, but that's what came to mind. And, that's got to be a challenge, right? Is, to get a patient to really integrate these things into their day. And any words of wisdom for other practitioners on how any tricks of the trade?
One of my patients actually showed me this journal that she found on social media that's about like gentle stretching or movement. And I think sometimes having some like tangible data for people
Hmm.
can be really helpful, where it's like, okay, if you have 5 minutes, here's, 3 activities you could do in that 5 minute span rather than just, maybe doom scrolling or
Right,
whatever
right.
it is. So I think like there are a lot of tools now, like, you can go on YouTube and, 10-minute gentle yoga flow. And so
Hmm.
I'll try to like give patients some of those ideas initially. And then sometimes they come back to me and they're like, look what I found, or, and they're
Yeah,
teaching me new things like this movement journal. I was like, gosh, maybe I'll get one of these for
yeah.
myself. And then I also have been a really big fan of, I don't know if you've seen them before, but they're like the wiggle boards. So you stand on it and they kind of like go back and forth a little bit. So I have a couple patients that are using those and finding them really helpful.
So is that like at your standing desk, or is that an actual, it's got like a cylinder and then a board that you balance on?
It's more like a standing, it almost looks like a scale, but like, maybe 8 inches high.
Okay.
And basically the whole premise is you can kind of adjust the settings from like low, which is going to be more of like you're moving your lymph, all the way up to like more of a intense workout, which is designed to help more with like muscle strengthening and even bone building. So
Okay.
sometimes for people who again are having trouble getting into a regular, exercise or movement routine, I think one of these boards, which, they're a couple $100s, so they're
Yeah.
definitely an investment,
Hmm.
but I've had some patients really, really enjoy standing on them. I have one myself. Sometimes I'll even do some strength training on
Uh-huh.
it just to kind of, build some different
Yeah.
muscles or whatever. So
Yeah.
I think that we have a lot of tools. We just,
Hmm.
need to find the right tool for the right patient.
Yeah. So you want them to move more, which, is good advice for anybody,
Yeah.
right? Everybody. What about their diet? What do you look for, or what do you try to just tell me what your approach is there?
So I'm generally of the impression of kind of recommending more of the Mediterranean like diet,
Hmm.
only because I think it can be really challenging for people when they go on some of these more restrictive diets. I think it almost acts as a little bit more of like a stressor in their
Right.
life then. So, and it's not just always about what we're eating, but it's also how we're eating. Can you take a few deep breaths before you eat? Really engage that parasympathetic nervous system,
Hmm.
preparing the body for food so we can actually break it down. So again, taking a few deep breaths, really focusing on chewing. There's a lot of people, they are eating in their cars. You've seen it, we're driving and people are, taking bites of a burger. And it's like, okay, so you're driving, which is already stressful, at least for me.
Yeah.
And now you're trying to eat as well. So, it's kind of, I think a little bit about like food hygiene, giving
Hmm.
gratitude for the food that we're eating, trying to slow down a little bit when we're eating, eating with friends and family, because then you get some conversation. So, it kind of slows down the
Hmm.
actual food eating part. And then again, really trying to focus on more of like the Mediterranean style of eating. So a lot of vegetables and some healthy grains, clean and lean proteins,
Hmm.
healthy fats. I do think a lot of folks out there are not consuming enough protein,
Hmm.
especially as, maybe they're getting a little bit older. So sometimes if people maybe aren't like huge breakfast folks, I'll say at least have a protein drink.
Hmm.
Whatever your protein of choice is, egg white, whey, pea protein, other plant-based proteins, because when we don't consume enough protein, then we're going to perhaps overconsume some of the carbs
Right.
and things like that.
Yeah. And for me, as soon as I eat something sugary, I'm going to want something sugary all day long.
Yeah.
So I try to have all my willpower when I'm at the grocery store. I don't bring it home.
Yeah.
And I've also, shifted over the last few weeks to having what I think is a much higher protein breakfast. So it's a couple of eggs, black beans. I saute up some spinach and some other veggies. And I feel like I don't need to eat for a while. It's very filling and sustaining, I would say.
Yeah, it kind of reminds me of when I was in school and, as like a kid, and it's like, I could eat probably 2 or 3 bowls of cinnamon toast crunch because there's really like no actual nutrients in it, right?
Exactly.
I'm like,
Yeah.
how am I still hungry? And now I
Yeah.
think about how my thought process has changed around breakfast and really trying to focus on protein and getting vegetables in the morning. I think we need to kind of reclassify what a breakfast food is.
Yeah.
And I think that's part of the education process, because most of us grew up with, toast and orange juice and sugary cereals and all of these
Right.
things. So again, that piece of education also comes into the conversation. And then another one that I haven't quite touched on is also stress management. I
Yeah.
mean, stress is a cause of inflammation. Our stress molecules promote inflammatory changes in the body. Prolonged periods of stress can even damage or shrink parts of our brain.
Mhm.
So I'm really focusing on the stress management piece as well, whether that's, helping find cognitive behavioral therapy for someone, or trying to find, a couple minutes outside every day, or again,
Yeah.
some of the deep breathing practices. I think stress is an often overlooked piece that also contributes to, tangible inflammation in the body.
Yeah, I mean, you mentioned the parasympathetic nervous system. So I've been very interested in the vagus nerve, and kind of goes in hand with deep breathing and some of those things. Any thoughts about how vagus nerve tone or stimulation can impact inflammation?
Absolutely. I mean, the vagus nerve, I think there are like some devices now, some like vagus nerve stimulation devices, even some that like clip onto the ear.
Mhm.
I think it's really impactful because the vagus nerve absolutely will help to reduce inflammation by putting us more into that parasympathetic
Mhm.
state, which is the state we need to be in for healing and repair.
Yeah.
Whether it's singing is actually a really good exercise for
Yeah.
the vagus nerve. So if you're a little shy about your voice, do some shower singing, whatever
Mhm.
it is, or like some of the yawning or deep breathing exercises are also going to activate that vagus nerve, and really just kind of improving what we call like vagal tone. Like,
Mhm.
how tonified is your vagus nerve? Like, we actually, at the clinic that I do some part-time work at, we have a tool that can kind of look at your sympathetic versus parasympathetic balance.
Mhm.
So it's really interesting because most people, of course, are going to be very sympathetic dominant. But then when you find that, it's like, now what are some tools we can give people to kind of help balance the scales a little bit more?
So is that heart rate variability that you guys are? Yeah.
Yes. Yep.
Yeah.
And I know that like a lot of the kind of smart tech, like wearable
Yeah.
technologies will look at some of the heart rate variability as
Mhm.
well. This the heart rate variability we have does, I think, give a little bit more kind of information versus
Mhm.
like maybe what like a wearable might. But
Yeah.
again, working on that heart rate variability, trying to increase it, is super, super important because we want our bodies to be able to adapt to changes, whether it's
Yeah.
big or small, and not be a major stressor to our body.
Yeah. No, I find that really interesting. I do have a smartwatch, and so my heart rate variability when I'm, feeling good or whatever, it goes very high at night, when I'm sleeping. Might be over 100 sometimes. If I'm sitting there watching TV, watching the news, it's gotten as low as like 6. I think I'm almost dead at that point. So I'm probably not even breathing, I'm just sitting there. But if I meditate, and the watch has this mindfulness setting that you can do it. I don't look at it, I just do my regular breathing stuff. But my heart rate variability while I'm doing that goes up over 100. So your breathing is just so incredibly important to all this stuff. It sounds like, so
That's amazing. I love getting some of that kind of real-time
yeah,
data. I personally don't have one of the wearables. I'm considering getting one
yeah,
just because I am curious of,
yeah,
my own, like how my heart rate variability may shift, in my day-to-day, like what I'm doing.
yeah,
But it's so interesting that you saw that it drops so much when like watching TV versus, meditating. So there are big shifts that we can make in our health by making, some of these
yeah.
changes.
Like if I could be more mindful with my breathing all the time, I'm sure my heart rate variability would remain high, but I'm not very good at that.
Yeah, it's
Apparently.
it's easy to get stuck in kind of that more superficial type of breathing
Yeah,
pattern.
exactly.
Mhm.
Well, that was a really interesting tangent. Thank you for
Yeah.
humoring me on that. Anything else you want to say about inflammation or treatments or anything like any other pearls, words of wisdom for other practitioners that you'd like to share?
So, kind of if we're just thinking about where to start with someone, I'm generally going to start with the curcumin with turmeric essential oil, 750 milligrams once or twice per day.
Hmm.
Most of the time, I'm also adding in, the omega-3s with phospholipids and peptides, just
Hmm.
because so many folks out there we know are deficient. And
Hmm.
then again, if someone is also dealing with lung inflammation, GI inflammation, joint issues, I may layer in Boswellia as
Hmm.
part of more of a protocol. And there are some specific ingredients I like to combine when it comes to pain, because we know one of the feeling signs of high inflammation can be pain. So
Hmm.
I think that there's a lot that we can do. And I'm generally, again, recommending these in combination with,
Hmm.
extra movement, focusing on nutrition, because, as NDs, we are looking for that root cause and helping people establish those healthy foundations.
That's great. Well, thank you so much for coming on the show. This was very fun to talk with you and very informative. I'm probably going to ask you to come on again for something else because this was great. I really do appreciate it. And thank you so much.
Yeah. Thank you to everyone who's listening. Always, always, always love to share, information and learn from the podcast that I'm not on. It's like I
Yeah.
love to listen to see what's going on out there. So thank you for having me.
Yeah, you're welcome. Thanks for listening to the One Medicine podcast. I hope you found today's episode interesting and came away with a few insights you can apply to your practice. If you're looking for the show notes, they can be found in the link below. If you want to go deeper on this topic or anything else, please visit todayspractitioner.com and consider registering for our weekly newsletter as well. Thanks again, and I hope you'll join us next time.